hope you all are doing great. So today we'll be studying about the Pharmacy Council of India, that is PCI. So basically the PCI or the Pharmacy Council is a statutory body that forms various amendments, rules and regulations that are to be followed by a registered pharmacy or any person associated with the pharmaceutical field. And this was established on 4th March 1948, just after the independence, and the first PCI was constituted by central government in 1949 under the section 3, and this council is every year reconstituted, okay, in every 5 years. Okay, it is reconstituted in every 5 years, so the members are changed, there are new people elected, and there are certain amendments in the laws, regulations, etc. So now let's move ahead with the constitution or the composition of the Pharmacy Council of India or the Central Council. Okay, so basically the Central Council consists of three constitutions. The first is the elected, nominated and the ex officio members. So we'll see in detail about these three. Okay, what are the regulations, what are the qualifications are required. Okay, so first is elected members. So in elected members there should be at least 6 persons to be elected by UGC from amongst the teaching staff. That is, the person elected, 6 persons elected should be of the teaching background. Okay, they should be of the faculty background of any university or affiliated college granting the degree or diploma in pharmacy. That means the college affiliated or university that is affiliated to affiliated should have the degree or diploma courses in pharmacy, so that from that background 6 teachers should be selected or elected, and amongst these there shall be one teacher of each pharmacy, pharmaceutical, chemistry, pharmacognosy and the pharmacology field. That is, they should have the masters in these field. Okay, they should have the teaching backgrounds in these fields, and one person elected by Medical Council of India from amongst the members, and one should be from the Medical Council of India. And there is a requirement of one registered pharmacy from each state among these members. So this is the way by which the electoral process is carried out and the members are elected. Second is the nominated members. In nominated members, 6 members are again nominated by the central government, of whom at least 4 should possess the degree or diploma in pharmacy or shall be engaged in the practice of pharmacy or pharmaceutical chemistry. Okay, in the elected members, all 6 members should have either the pharmaceutical, pharmacognostic or your pharmacological or your pharmaceutical chemistry background. But in this nominated members that are nominated by the central government of India, out of which the 4 should have at least a degree of pharmacy, that is involved or indulged in the pharmacy practice, okay, or pharmaceutical chemistry. One registered pharmacy, same as that of the elected member, and very important here, one representative of UGC and AICT. Now these two bodies again help in the regulation of your different pharmacy practices. Okay, that will be seen in the next topic. Let's move ahead to the third, that is the ex officio members. Okay, so in ex officio members we will have the Director General of Health Services, the Drug Controller of India and the Director of CDL, that is a Central Drug Laboratory. Now let's see what are the functions of the Pharmacy Council of India. Alright, so we'll just one by one list down the actors or the functions that a Pharmacy Council of India withholds. Okay, what are its duties, roles and responsibilities? So first is to prescribe the minimum standards of education required for the qualification of pharmacists. The PUF, the first initiative objective of Pharmacy Council of India is to provide or prescribe minimum standards relating to the education field as a pharmacist. Next is to frame the course study of for the pharmacist. Obviously, it is related to the first one. If it is prescribing the minimum standards, it should also design the course of study. Then similarly, if it is prescribing certain standards, framing the course, it should also have to regulate it. Framing is nothing much big deal, but the regulation is compulsorily needed. So it looks towards the regulation also, okay, whether the prescribed standards are followed or not. Then we have to maintain the central register of pharmacists. All the registered pharmacist lists are to be carried out in 2024. These are the list that people are registered pharmacists, got the license and are qualified in this state and another. So they should be having a central register, okay, and a record of it. Then to fix the powers and duties of the president, vice president, secretary, etc. of the council. Very, very important. If there are no board members assigned and no powers assigned of these important board members, then obviously the council will not be able to function properly. So this is very important. To fix the rates of remunerations and other allowances payable to its member. Whatever the fee, remunerations or allowances are to be prescribed to the members of the PCI, okay, that is also one of the important function of the Central Council. To prepare education regulation, this is relating to your first 2 points, okay, so you can just mention it. To inspect the institutions by appointing inspectors. Yes, there are various inspectors, those who go for inspections around the pharmaceutical industries or pharmaceutical colleges, wherein the pharmacy practice is carried out properly, whether the people are getting educated or whether there is any malpractice. Okay, so they are inspectors who are appointed for inspecting such institutions. Then to give approval to the institutions for running a pharmacy course. Yes, this is very important point. If a college is for the diploma in pharmacy and wants to open a degree college, so it should be having proper equipment facilities, proper faculty, proper non-teaching staff. There should be proper environment, there should be proper sustenance, there should be perfect people, or there should be ample of what can I say, ample of requirements for the particular course. Okay, there are certain lists that you need this many heating metals, you need this equipment. So if the following list rules or standards are maintained by the so and so college, then it can go for the degree colleges, and similarly for masters and PhD also. Okay, so the colleges need certain requirements and certain approvals, so that is also decided by the PCI. Any other function that is related to the central government. I hope this topic is understood. Now there are various questions asked in your semester papers also, whether it can be asked like give the regulatory bodies of PCI and state its functions, or it can be from it can also come as give the composition and functions of the Pharmacy Council of India, or prescribe Pharmacy Council of India and India functions. Okay, so there can be ample of questions which are also asked in the PYQs, previous year questions, semester papers. So this is a very important topic. If any more doubt, you can just comment down. Thank you.